Hello, hello, Facebook family and friends. It's Dr. Abby Connell from Carolina Hearing Services, coming to you from Charleston, South Carolina for our weekly Facebook Live. Today's topic, earwax. What? I'm sure y'all are like, earwax? Who wants to talk about earwax? Fortunately for me, I get to talk about it every day. And it's funny because earwax is actually a naturally formed substance that is formed from glands in our outer ear canals. And it typically forms in the outer third of our ear canals. Earwax is typically something that naturally comes out of the ear on its own. So we're going to talk about a couple of things. Why do we have it? How do we know if we have it, and what do we do about it if we have it? Thank you, Chandra. I'm excited that you're excited about earwax. I actually do a lot of earwax removal. As a doctor of audiology, I have had specific training on earwax removal, but I will definitely make the disclaimer that not all audiologists or hearing aid dispensers are allowed to or comfortable removing earwax. So it's important to know that the person that is removing earwax is trained and capable of doing so in a safe and clean manner. ENT physicians and physician's assistants that are typically at ENT offices can also remove earwax, but you don't always have to go to a physician. Unfortunately, Medicare and insurance companies will not reimburse audiologists or doctors of audiology, so we typically have a reduced fee schedule for earwax removal here in our office. If you do go to an ear, nose, and throat office or even a primary care office, typically insurance will cover that. It's kind of an interesting thing though, because you'll get an office visit charge, you'll then get all your charges for the procedure when you could have maybe just had it removed in my office for 40 bucks. So just something to think about. As you know, I like to give you any and all information, whether you find it useful or not, but that's just one of those things that some people will say, well, my insurance will cover it, so I'll just go there. But if you have co-pays and things like that, it's just good to know that, paying out of pocket is not necessarily a bad thing. So I'm going to show you a couple of things regarding earwax. And so because I didn't want to save all the earwax I've been collecting from people's ears all week, I'm going to use my little cotton dome that I have in this ear canal. I'm seeing just a little bit of a glare. There we go. So this is your outer ear here, which is called your pinna. And then this is now your ear canal. At the end of that would be your eardrum, and then moving into the little ear canal bones on into the inner ear. Today we're focusing on the ear canal itself. So earwax, as I mentioned earlier, is a natural substance. It's produced naturally by glands in the outer third of our ear canal, so the outermost third here. The issue with earwax is that most of the time, if you just let the warm soapy water when you're in the shower literally run through your ear canal, it's going to flush out most of the newly formed wax. Most people say, or not most, some people will say, oh, I was told never to get water in my ears or it's going to get stuck in there. Not the case. The only way that water is truly going to get stuck in your ear is if you already have a wax plug and the water is getting past it and then it can't flush out. But when you have an intact eardrum, if you think back to your junior high or high school physics class, the ear canal is a tube closed at one end. So the water goes in, the eardrum, if it is intact and doesn't have a hole or a PE or a pressure equalization tube in it, it's gonna flow in and flow out. For most people, newly formed earwax is very soft and it's also pretty liquidy. It's almost honey-like in color, but it's very soft. The longer that it stays in the ear canal, it's going to get darker and harder, and it's going to get more difficult and more painful to get out of the ear canal. So as we're looking at this ear canal that has a pretty good wax plug in it, as shown in my little cotton ball there. A lot of people will say, I use a Q-tip every day. Don't use Q-tips. Bad, bad, bad. You can use a Q-tip on the outer ear, but not in the ear. No matter what satisfaction you get from scooping out wax on a Q-tip, I can almost guarantee you that more than what you got off on your Q-tip is getting pushed down. I have a lot of patients that will say, oh, I only put it right in the opening. Well, the ear canal and the diameter of a Q-tip are pretty similar. So even though you think you're only putting it at the entrance, you're still going to push a bunch of it down. The further it goes down, the worse your hearing is going to be. You might end up having ear pain. You might feel like you have ear popping. You might also feel like you have a lot of itching in the ears, like you constantly have to push on it. Once that wax continues to build up and get pushed further and further down, there's almost nothing over the counter that you'll be able to use to get that earwax out. So that's when I'm going to come in and I'm going to put my handy dandy goggles on. Ooh, that is nice, right? Yep. So I'm going to come in here and I'm going to be looking into your ear canal. I will have already been finding it with my otoscope, seeing how far down it is, how dark it is, and then I'm going to start coming into the ear canal with any one of my little tools. So with these tools, they come in all kinds of different shapes and sizes. Some of them have, let's try and get that clear. Some of them have little loops like that on the end. Some of them have little scoopers, just like that. And sometimes when it's really hard, we have to get in there with some little alligator forceps. So in this case, we've got that wax all the way down in there, so I'm gonna be coming in there and I'm gonna have to get way down to try to get it out. And then I'm gonna tell you, quit using Q-tips. So no Q-tips. Q-tips are bad, and that's really why. Once it gets all the way down there, you're not going to be able to get it out. If you know that you have a chronic earwax problem, you can use on a regular basis most over-the-counter earwax removal kits are typically made of some kind of a peroxide solution. I would highly recommend, and my go-to favorite is called Earache. Earache is made of a carbamide peroxide solution. Carbamide peroxide is very similar to hydrogen peroxide, but it's not quite as drying. Some people that use regular hydrogen peroxide will say that their ears get really itchy. Some people use rubbing alcohol and say that it gets really itchy. That's because the hydrogen peroxide and the typical over-the-counter isopropyl alcohol is very drying. So it's going to dry the natural skin oils that are developing in your ear canal, and then you might develop flaky, itchy skin, which can then also collect with the earwax and create more of an impaction. So you want to, get an idea of whether you really have a lot of earwax or if you don't, so that you know how to properly clean them. As I mentioned, if you do have a lot of earwax, and for all of my patients, when I'm removing earwax, I will say to them, it typically takes me 6 months to learn what your earwax habits are. And while it sounds like that's a weird thing, dealing with ears and hearing every day, that's totally normal for me. Once I have an ear canal totally clean, then I will say, let's go ahead and start a once a month or a once a week, just depending on what your typical wax buildup is. You can get the Earache or any generic 6.5% carbamide peroxide solution at really any pharmacies, CVS, Walgreens, Rite Aid, Walmart. Usually I see them in the aisle that usually has like foot care, nasal sprays. The Earache comes in 2 different kits. You can get the starter kit, which comes with a bottle of Earache and a little bulb syringe, or they also then sell refill kits that just have the bottle of the Earache solution. There's great instructions on there, but typically you put about 6 to 7 drops in the ear. It's best to do it while you're laying down on the couch or on the bed so that you can keep your head completely flat. You want to be totally horizontal. That is going to then allow the solution to bubble up like peroxide does, and it's going to fizz. You typically keep it in there for about 10 minutes. And then you want to let it drain out onto a paper towel, do the other side, and then I find it easiest to just get in the shower. And now let the warm soapy water purposefully flow through your ear canal for a good 30 seconds to a minute. Sing a song, I don't know, go over your to-do list, but you need to make sure that you're rinsing it out enough. Just doing a couple of squirts in the ear is not going to flush that solution out. So remember, if you think back to our little ear canal, you want to make sure that you're taking that warm water and you're flushing through enough times that it's able to get all of the debrox solution and the wax to come out. If you already have a wax impaction and you start using the debrox, it'll probably get worse before it gets better because it's going to soften it up and then it's going to get all goopy in your ear canal. And you're going to really feel like your ear is clogged. You'll feel a fullness in your ear. You might feel like your ear keeps popping. So if you have any questions whatsoever about whether you typically do have an earwax problem, you definitely want to talk to your hearing healthcare specialist. And you want to make sure that you're keeping your ears clean. Typically, just letting the warm soapy water run through your ears every time you take a shower is going to do exactly what needs to be done. If that's not working, then you can either make regular scheduled appointments with an ENT or with someone like myself, a doctor of audiology who's trained in removing earwax, and you want to get on a regular schedule. So I do see some people back once a month for wax removal. Some people I only see once a year for wax removal. The primary thing is to remember, never, never, never stick a Q-tip into the ear canal. Outer ear is fine. Don't be tempted to get it into that ear canal or you're just going to push it further down in there. Another big no-no is ear candling. Ear candling, crazy town. It's in boutiques and spas, like it's some fad thing to do. Danger, danger, danger. So ear candling is a method that was developed where you take a candle and you light the candle and the wax from the candle is going to drip down into the ear canal and it's going to create a suction, and then when you pull it out, it's pulling the earwax out with it. I have seen some horrible things secondary to ear candling. So first and foremost is burns. You can catch your hair on fire, you can catch your skin on fire, the hot wax dripping into your ear canal. Worst thing that I've ever seen is that the hot wax went all the way down into that ear canal and attached itself to the eardrum itself. Person pulled that out, and out with it came the eardrum and all of the little middle ear bones. No ear candling. Very dangerous and almost never effective. Most of the wax that actually comes out is the wax that was melting from the ear candle itself. So no Q-tips, no ear candling. Make sure you go see your hearing healthcare professional to get your ears checked if you suspect that you have any wax issues. Get yourself some debrox or any generic version. Just make sure that it's an actual earwax removal solution and not just a softener. Earwax softeners typically just are made of an oil base and like mineral oil or something of that sort, and it doesn't actually break it up. Get your ears checked regularly. If you have any questions whatsoever, as always, you can contact me directly at the Charleston, Carolina Hearing Services office. Our direct office line is 843-556-4327. Or like I said, you can always message me, email me, audpractice.net, or give us a call here at the office. I'm Dr. Abby Connell. Thanks again for joining me. I look forward to seeing you next Wednesday. Have a great day, everybody.